Each day we do rounds of each patient's bedside, and that became quite a deeper conversation because we knew the preferences. We knew from a variety of different aspects what was important to the patient and their family members and their support system.
Michael, how did your staff respond to becoming an exemplar program for the Whole Person Care Initiative?
Knowing that administration, the executives, and that we had physician champions willing to take this on, we were very excited about being a site chosen to be able to do this.
My caregivers here at Providence made me feel like a person, not just a number going across the table.
He treated me as not only just a patient, a coworker, but also more importantly, a friend who needed someone to just kind of put the medical lingo aside and be my doctor who genuinely cared.
This is what we're all about, and it's easy sometimes to forget that in the business of medicine and the business of running a hospital, but this truly is who we are, and these are very important tenets of our mission, our core values, and you know, who we want to be.
Practicing as a neurologist, I often dealt with very challenging bioethical situations that created a lot of tensions both for physicians and nursing teams with respect to what would the patient want, what would the family want.
It's so incredibly important. Being a nurse for almost 6 years, but then having played a patient, I really began to understand what it's like to be treated as a whole person.
If you have any questions at all, they always make you feel at ease through every step of the process, all the way.
So having those relationships with patients and their families, we may see them periodically in the hospital, but how do we really help them in their lives, in their healing, and having broader conversations with them? Not just the physical status of the patient, but what's going on with them emotionally, what's going on with them spiritually, what's going on with them maybe economically or with their family dynamics.
It's a must-have. You can't be talking about and boasting about a full spectrum of care, a continuum of care, of taking care of a whole person without inviting this aspect of care into what we do.
You know, it makes you feel really good when you do see them focusing now on more pertinent questions than your standard history and physical.
What would you say to other chief executives who are considering whether or not to become a whole person care center of excellence?
Well, that's easy. I would say do it. I think as all chief executives, we're very proud of our ministries, we're very proud of the work that they do, but when you embark on a program like Whole Person Care and the Exemplar program, you can't help but be more transformed, more intentional about what you're doing, more intentional about the conversations, and it spills over into every single thing that you do.
I think that this is something I would highly encourage to other ministries because it does keep the patient and the whole person up front where it should be.